What are the microscopic signs of early raw diagnosis? Imagine peering into a tiny joint and seeing the first signs of trouble at a cellular level. That's what microscopic examination reveals in early rheumatoid arthritis. The key feature is synovitis, which is inflammation of the synovial membrane lining the joint capsule. Under the microscope, one of the earliest signs is synovial hyperplasia. This means the lining cells, called synoviocytes, start to multiply rapidly, causing the synovial lining to thicken. This thickening is a hallmark of early autoimmune activity in the joint. Along with this, there is a notable infiltration of immune cells into the synovium. T lymphocytes and B lymphocytes, which are types of white blood cells involved in immune responses, begin to invade the tissue. Macrophages and plasma cells also gather, fueling the inflammation. These immune cells attack the joint tissues, leading to the symptoms patients experience, like swelling and stiffness. Sometimes, these immune cells organize into clusters called lymphoid aggregates, which resemble lymphoid follicles. This indicates an active and ongoing immune response within the joint tissue. The blood vessels in the synovium also become more numerous and active, a process called angiogenesis, to support the inflamed tissue. This increased vascularity helps supply nutrients and immune cells to the area, perpetuating inflammation. Fibrin, a protein involved in blood clotting, can deposit on the synovial surface as a response to ongoing inflammation. Although early cartilage and bone damage might not be visible under a microscope, activated synovial cells known as pannus can begin to erode cartilage and subchondral bone. These microscopic changes often precede visible joint damage seen on imaging studies. Understanding these microscopic signs helps explain why early rheumatoid arthritis can cause symptoms like joint pain, swelling, and stiffness even before significant damage appears on X-rays. It also highlights why early treatment with anti-inflammatory medications can be so effective in preventing joint destruction. Keep in mind that while microscopic examination of joint tissue is not routine for diagnosis, it can be very useful in research or complex cases to confirm synovitis and understand the inflammatory process better. In essence, the microscopic signs of early rheumatoid arthritis revolve around inflammation, immune cell invasion, increased blood vessel formation, and early tissue erosion. Recognizing these signs helps clinicians diagnose the disease sooner and start treatments that can preserve joint health. Always consult with a healthcare professional for personalized diagnosis and management, as individual cases can vary widely.